right, Shauna. So you just cared for a patient who had a hip replacement. How did that go? How did that feel for you?
Um, it was rather scary because there were so many things happening at the same time. I'm not sure I always did the right thing at the right time.
Mm-hmm. Yeah, that can be overwhelming.
Yeah.
So, mm-hmm. The patient's heart rate was 110. What did you think about that?
Well, I wasn't sure why it was that high, and actually, I did think it might be the pain, so I asked him, uh, and he was in pain, but I forgot to ask like in a quantitative way how much the pain was. So I think I missed a few things there.
Okay, so I'm hearing that the heart rate could be elevated because of high pain, and that's correct. Good. All right. What interventions do you think you might do next?
Uh, Definitely, we need to manage the pain because he is in quite a bit of pain. But uh,
Mm-hmm.
I I think we need to also see if there's some other things going on and what I should be looking at. I'm not quite sure about that. I'm not sure I'd really looked.
Mm-hmm. So, of course, you want to do a pain assessment, right?
Yep.
See, compare to how the pain threshold has been trending.
Yeah.
You do a pain assessment, see when the last time the patient had the pain medication, see what
Okay.
dose it was.
Correct.
Um, think about positioning.
Oh.
Is there a position we can do to make the patient more comfortable?
Ah. Do you
So
think I
there's a
should?
lot to think about.
Excuse me. Should I have asked whether he wanted some pillows or something?
Absolutely. You can think
Mm.
about turning the patient and what you can ask the patient himself what position is most comfortable.